Hello, in today's video I'm going to talk about sudden infant death syndrome, SIDS. It is simply a term that is used to describe the sudden death of a baby below the age of 1. This happens unexpectedly and the cause is unknown even after a full investigation. What are the causes of sudden infant death syndrome? The cause is idiopathic. It is unknown. However, research have shown over the years that there are things that could predispose a child or could cause a baby to die suddenly. Observations during clinical practice also shows that there are things that could also predispose a baby from dying suddenly. Number one thing is not burping a baby after feeding. Not burping a baby after feeding could make this baby to be choked. Not burping a baby after feeding and putting the baby down immediately, that is lying the baby down immediately, can make the baby to aspirate without you even knowing. Another cause is brain defect. The part of the brain that controls respiration and waking up from sleep could be affected even if the baby was born at 9 months, and this can lead to sudden infant death syndrome. Another thing is babies born prematurely. That is, babies born below the birth weight of 2.5 kilogram. What happens still is that the part of the brain that controls waking up from sleep, sleeping and waking up from sleep, and respiration could be affected, and this will make the baby to pass on without even the mother knowing. Wrong positioning is another thing. Placement. When a baby is sleeping, if the baby is not properly placed, the baby can pass on. So the best way for the mother to position this baby is on the back. Please, mothers, make sure to position your baby on the back. That way this baby is not affected. Another thing, babies could be stuck if their crib, that their bed, is full of crumbs or is full of toys or is full of pillows or extra clothing or sheets. Babies can bump their head and get stuck and lose their respiration without even knowing. Another thing is a baby that have respiratory issue or diseases. This baby can have problem with breathing and they can pass on because of that. So when your baby is sick, please endeavor to take the baby to the pediatrician so that baby will be properly treated. Poor antenatal. Mothers that don't attend antenatal and listen to classes to be able to care for their own babies, because newborn care is something every mother should know if they attend antenatal. Abandoning the baby with adults, assuming that they know how to care for baby, can also affect this baby. Please observe the baby and make sure that before you leave your baby in the care of an adult, that the adult knows how to care for the infant. What are the prevention? Before I talk about the prevention, let me quickly mention that babies that are born around people that smoke are second-class smokers. So please, as parents that smokes, I want you to please change because of your baby. Avoid smoking around these babies because it affects their respiratory rate and heart rate. Another thing is mothers that smoke and do alcoholism. Please and please again, it can lead to birth defects. Please avoid smoking and drinking alcohol when you're pregnant. Let's quickly talk about prevention. What can we do to prevent this? Make sure that you are sleeping with your baby until the baby is at least 6 months or 1 year before taking them to the children's room, so that you can have a close eye on them, observe them while they are asleep. But please do not sleep with this infant at this age, because adults can sleep and forget and roll over this baby and strangulate the baby without even knowing. So let them sleep in their own crib while you observe them, and make sure that you position them properly. Burp your baby after feeding. Burping the baby will help the baby to remove the air and carry the baby for at least 30 minutes before putting the baby on the back. This way, what the baby has eaten will settle and not making the baby to aspirate. Some people, they are quick to drop the baby immediately after feeding this baby, and it's not right. Please burp the baby before putting the baby down and place the baby while they are asleep on their back. Please avoid extra clothing, extra sheets, toys, pillows on the baby's crib. This can make the baby to be stopped without you even knowing. And make sure that the baby's crib is very low and not high, so that they don't fall from a height when they are rolling over. And make sure that your baby's crib have rails that protects this baby so they don't fall off. Always put your eye on your baby and don't assume that adults that they can take care of this baby. Make sure that you are leaving the baby in the care of a prudent adult that can care for this baby and be accountable for the baby. These babies are babies. They cannot speak for themselves when they have problems. So please, mothers, let us make sure that we protect these babies. Let the baby be vaccinated, and while you are pregnant, get vaccinated. Avoid smoking, avoid alcoholism to avoid birth defects. Thank you. I hope this video is helpful. Thank you.